This movie shows some of the consequences of the loss of a single lower tooth. The distal tooth may tip and drift into the empty space to such severe levels that it may prevent replacement of the missing tooth area and create a poor periodontal situation for itself and the opposing teeth. Here we have an immediate implant placement followed by the post and core, which is secured to the implant fixture, followed by a crown. In this situation, we do not involve the adjacent teeth. On the left, we have the bridge option. Here we must cut down the adjacent teeth. There is significant tooth reduction, and the teeth may become sensitive or even need root canal treatment at this early stage of the process. A bridge, which is basically two crowns with a tooth in the middle, is cemented on top of these prepared teeth. Comparing the two situations at the early stages of post-treatment shows that they can have similar cosmetic results. However, with the passage of time, there may be bone atrophy in the area of the missing tooth, which often leads to recession around the adjacent teeth. Depending on the margin integrity, cavities may start to form. The implant is placed with the healing cap on top of it at the same time. The flap is then repositioned and sutured into place. After a few months of healing, the implant fixture is then placed into this prepared site. Note that there is a bone defect on the one side. If this defect is small enough, it can also be corrected at the same time as the implant placement. Bone or bone substitute from various sources can be placed in the defect. The cover screw is inserted into the implant to cover the internal threads, and a resorbable membrane can be used to cover the area to help with healing. The flap is repositioned and sutured into place. A provisional denture can also be inserted at this time to temporarily replace the missing tooth during this healing stage. The sutures are resorbed or removed, and the membrane underneath the gum tissue will resorb with time. The surgical treatment involves retracting the gums and placing 5 to 7 implants in the remaining bone along with the healing caps. The gums are repositioned and sutured into place. The sutures are removed or they will dissolve. Then there is a waiting period for the implants to osseointegrate or take. During this waiting period, the patient can wear a provisional denture. It has a soft cushion lining to protect the implants during eating. Once the implants are ready for final restoration, we replace the healing caps with special attachments. The prosthesis replaces not only the teeth, but the soft tissue. With teeth missing in the posterior upper arch, there is a steady expansion of the sinus space and subsequent loss of bone in the area. This movie shows the posterior upper jaw atrophy to 7 millimeters of available bone. It would often be necessary to perform a sinus lift procedure if standard length implants were to be used. In this situation, however, Bicon dental implants that are only 5 millimeters in length and width are used. They are then restored as usual a few months later with post and cores and crowns. Here we see a case where bottom arch atrophy and proximity of the mandibular nerve seem to make placement of an entire arch prosthesis impossible. By spreading the implants as far apart as possible, and by placing the most posterior of those implants at an angle to avoid the nerve areas, we see how this implant-retained arch can become a reality.